Store Server. Welcome, Jeff.
Thank you, guys. Thank you. I want to thank everybody here at Himss for putting this together, and thank all the presenters so far. How about you, Han? Let's get another hand for that guy. That was a really nice presentation. He kept everyone engaged during lunch. I think we share a Netflix queue, but that's just me and him. So I am here representing Store Server. We do data backup and recovery, data protection for companies, and we're very driven to help the healthcare industry. One of the differentiators for us is that we do custom-built appliances. That plays real well in healthcare space because, as you guys all well know, one size does not fit all for healthcare. We do also have a fast implementation, so we are performing our backups on day one. Because as you guys are also aware, in a 24/7 environment, you don't really have time to take an extended rollout, especially when it comes to data protection. Just a couple of quick notes about Store Server before we get started here. And I am introducing the 2016 Innovator Pitch-a-thon. I've had a chance to go around and talk to all these guys and ladies, and we got some really great companies here, so we're excited to get this thing started. So first, let's bring out Tony Cinquegrano from National Physician Services talking about Datria.
Hi everyone, my name is Tony Cinquegrano. I'm with National Physician Services. Joining me on the side there is Brian Graven, he's our CEO. NPS was created about 10 years ago by physicians and led by industry technology experts. Our services run the full spectrum of healthcare IT management. They include things like revenue cycle management and other MSO services. We have strategic partnerships with best-of-breed industry vendors. You see the vendors listed there. You know, we implement, we support, and we provide services around all those solutions. And the reason why we're here today is to talk about one of those companies. It's called Datria. It's a new category in healthcare data storage. Datria was created by industry visionaries. You see one of them listed, two of them listed up there. Really to change this data storage industry forever. Brian Biles is the founder of Datria, but he was also the co-founder of Data Domain. And Diane Green was also a founder of VMware. So if you're familiar with VMware, it's used in about 80% of hospitals. Why is it important to you? It's important because the infrastructure is really the heart of your practice. Without a powerful infrastructure, your clinical applications are slow to respond to your end users. They lack scalability and will be the bottleneck in delivering transformative healthcare. So I like to say that legacy storage solutions are a little bit like station wagons. And Datria is really, we were trying to think of a good analogy, but Datria is really like a spaceship. It really changed its industry, and some specific facts on why you should choose Datria for data storage. Number one, it's 10 times faster and costs half as much as any legacy storage solution on the market. Number two, it works with any existing infrastructure, so SANs, hyper-converged infrastructure, servers. When you need when it's time for replacement, you can also use Datria. It lasts twice as long as any storage system on the market. So those biannual refresh notices you're getting go away. Four, your engineers really will love you because it's way easier to manage. It can potentially save you on full-time employees depending on the size of your infrastructure. And five, this is amazing, as you increase your size and as you increase your scale of storage, your performance increases as well. So folks, this is truly innovation at its best. Don't wait, it's here now. Stop by our booth and take a look at it. We'll get your card. We'll provide you with the complete information you need. And here at NPS, our goal is to provide you with the best possible user interface. Thanks.
Thank you, Tony. So storage is something that we all deal with on a daily basis, and one of the reasons we were excited to sponsor the Pitch-a-thon here is that data backup and storage is a key aspect of your environments today. So this next presenter that we're bringing up here is dealing with analytics, as several of our companies are. We all have lots and lots of data, and this is helping us make some sense of that data and make good use of it. So please welcome from Point Right, Richard Juknavarian.
Well, good afternoon, everyone. My name is Richard Juknavarian, and I am fortunate enough to look after product management for Point Right. For those of you who are not familiar with Point Right is a provider of post-acute care data analytics. So really what that means is we're very interested in all of the events that happen to a patient as they move along the spectrum of care from the acute care environment into various post-acute care settings. And we are able to produce and develop various prescriptive, descriptive, and predictive analytics based not only on the patient and how the patient will potentially perform in the post-acute care environment, but also on the health of that post-acute care environment. So not only are we able to understand the patient's likelihood for success, but also the post-acute care building's likelihood for success. And we do that via a number of different ways and different data that we collect to do that. Many people are familiar with the statement that Deming said, "In God we trust, all others bring data," and we really adhere to that at Point Right. We have various public and private data that we're able to get our hands on. So think the nursinghomecompare.gov data that you may find around Medicare 5-star ratings. What we like to do is consider what we have available as 5-star on steroids. Really an opportunity for you to focus in more specifically on the post-acute care outcomes and not so much on maybe a survey issue or a deficiency or a fire code violation. And sure, it's really important that your loved one is not in a skilled nursing facility where there's potentially going to die in a fire, but it's also really important to understand that that particular nursing home or that particular rehab facility is best suited to take care of your patient based on their clinical conditions. This facility is better at diabetics who are recovering from a stroke than the next facility. So when we work with accountable care organizations or we work with managed care organizations, what we really do is help them to understand from a referral network and from a referral management and a referral development perspective who the best facilities are for them to be working with. The other side to that story for the post-acute care is how do I market myself best? How do I put my best version of myself out into the market and tell the best story that I can tell in terms of, hey, MCO, hey, ACO, I want to be part of your bundle. I want to be part of very value-based payment initiatives. Let me show you how I can be most successful in treating your diabetic stroke rehab patients. When it comes to your, bone and joint and hip rehabilitation, not really my strong suit. So I'm not going to put myself into a position where I may take those patients. And again, from the ACO perspective, I now know when I'm developing my networks, I'm managing my networks, I can send my patients to the right point in the post-acute care continuum. So really what we do with our data, what we do with our scorecards, what we do with our prescriptive and descriptive analytics is bring those parties together, the accountable care organizations, the managed care organizations, the at-risk entities, with the providers, have them on that same page, drive that transparency between those entities, have them all looking at the same piece of information. the same opportunity for them to speak from that same hymnal, if you will, in terms of being able to understand who's best suited to handle their patients, who's best suited to drive the best outcomes in the post-acute care environment. So we are Point Right, and we are changing the way that our nation is caring for its elders. Thank you.
Thank you so much, Richard. Point Right. Got some fans in the audience, like to see that. So just to let you guys know, these first three presenters are in our first category, and that's companies with more than 30 employees. So just keep in your mind there are two different categories of presenters here. Our next presenter is from Reinforced Care. They also do analytics with different data and different analytics. Here comes Mr. Roland Stark to talk about Reinforced Care. Thanks so much.
Hi everybody. Reinforced Care is a technology and data-focused program that supports patients through outreach post-discharge from hospital and does predictive modeling to help hospitals decide about patients who most need extra interventions. So we focus on reducing readmissions and reducing hospital costs. We're adept at pulling in data from disparate sources and on different time frames from our hospital clients. We feed the data into what you could call a rules engine, which has been configured by all the specific, patient-specific and type-specific protocols hospitals want to see us follow in reaching out to their patients. They want to know we're calling the right people on the right time frame, using the right scripts. Pneumonia patients need to be asked about whether they're taking their antibiotics. Heart failure patients need to be asked about weight gain and fluid retention, and so on. So all these factors are taken into account and assembled into the program of calls, of phone outreach that we conduct. And the big outcome of that will be we'll be able to select people who need additional help from the hospital. So we don't want the hospital's clinical people spending their time tracking down phone numbers, dealing with busy signals, doing all these things where they are paid to do much different work, right? So we have non-clinical people talking to patients for them and finding those who really do need clinical assistance, who have problems filling a medication, who have symptoms that are not resolved, who need additional services, can't get home health care. These kinds of things, the hospital does want to be involved in helping resolve these situations. But what we can do in the meantime is we can reinforce discharge instructions. We can push information such as the fact that the hospital wants to encourage them to use an advice nurse line rather than necessarily an emergency room to help save the hospital money, background issue. We can obtain information about how patients are doing in obtaining medications, getting to appointments with follow-up providers, getting the equipment that was ordered for them, and so on. We do this in multiple languages. We can reach out not just by phone, but through email and text and IVR. The escalations, the situations that require the hospital's clinical team support, we send to them through codes and through text, through a proprietary portal. And this portal has a lot of uses. It functions as a kind of communications hub because the hospital people can communicate with one another. You know, a pharmacist can tell the nurse, I've taken care of this patient's pharmacy issue, but you still need to resolve the symptom issue. So there's information flowing back and forth within the hospital to us, instructions for us to give to the patients, information flowing all around through this portal. Hospitals can also take data which has come from the hospital itself through our feedback, information from the escalations, and all that can be analyzed and exported for their own use. So that's, in a nutshell, the outreach that we do. Now I'll talk a bit about the predictive modeling. We can also take the initial information, we can feed it into a customized statistical model that helps predict things such as extent of utilization of services in dollar terms or risk of readmission. So these calculations about patient risk scores go right into the portal as well. So each day the hospital can see the scores of the admitted patients, and they can make selective determinations to target patients selectively based on their apparent need for further interventions. It might be a medication reconciliation, it might be an additional nursing visit, it might be extra transportation help, whatever the hospital thinks would support that patient and help avoid further readmissions. A bit about results. We've been able to reduce readmissions by, you could say 11%, but why divide the 11 by 100? Divide it by the number that are actually preventable. The best research out there has shown that about 23% of readmissions are preventable or avoidable. So if you divide 11 by 23, you get just about 50%. That's our record in collaboration with hospitals in reducing readmissions that are avoidable. And then a bit about the accuracy of prediction. You probably recognize concordance as the metric most often used in healthcare when talking about binary outcomes like readmission. Most readmission predictive models in this country have concordance between about 0.58 and 0.74. If you use this LACE model, which is free and an algorithm that many hospitals are taking advantage of, you get about a 0.65 concordance. We've been able to get close to 0.70 in most cases, sometimes a little less, sometimes a little more. And in one case, we took a population that was very difficult for this hospital's own statisticians to understand and predict readmission for. We were able to do better. We were able to do better in predicting their outcomes. Thank you very much for your attention.
Thank you, Warren. Good information there, really important stuff. These are very short presentations, but we do encourage everybody, once this is concluded, to take some time and really walk around to all the sites over on the far right of, far right side there, and get a little bit more in-depth information about those companies that might be interesting to you. And then, of course, after you've discussed about all the interesting things you can do with data, come back over all the way on the left and talk to me about how you can protect that data. So that ends the first category, and we're starting the second category of companies with less than 30 employees. First up here from Blue Point is Mark Scagliorini.
Good afternoon, everyone. The Institute of Medicine estimates that 30% of healthcare spending is wasteful, representing $700 billion in unnecessary cost. In the era of value-based medicine, health systems across the country are pursuing ways to increase the quality of their care while reducing expenses at the same time. As an extension of their team, the Blue Point team is partnering with these health systems to identify and reduce unnecessary variation in product and device usage that often leads to variation in clinical care. Our work has a direct impact on the cost and quality improvement initiatives. Blue Point is structured as a subscription-based SaaS model. We support our customers by providing advanced comparative analytics, proprietary custom product classification schemas, and data visualization tools to turn health systems' transactional spend data into a powerful asset that they hadn't had before. But we don't stop with the data. We then compare the health system's product usage rates to clinical effectiveness best practice recommendations from across the country, and then allow them to compare those usage rates of their devices to health systems in our database across the country as well. All of this data and comparative analytics are supported by our clinical effectiveness team's clinical research, and we literally make our customers more efficient by giving them full access to a clinical effectiveness library and that research. One of our customers, for example, is a 3-hospital health system. They have a problem with high CAUTI rates, despite the fact that they're buying more than $250,000 on an expensive, specialized, treated catheters. They're clearly trying to solve a quality problem with a product. What they could not see until they worked with Blue Point, however, is that 80% of the other health systems in our database weren't buying that same specialty product at the utilization rate that they were. And more importantly, that their real issue was that they were inserting 15% more Foley catheters than anyone else in our database. They now have visibility into the real problem and an action plan to drive results. Improving patient care and outcomes does not have to cost more. Hospitals have a history of buying the most expensive products when maybe they weren't needed, of buying extra attributes and features that maybe aren't always used, and having limited visibility into product waste. We finally have created solutions that can allow them to uncover these opportunities. Our goal is to take hospitals' big transaction data sets and make them small, meaningful, and actionable. We add visualization and benchmarking to create insights to help them identify and implement, and most importantly, sustain new product savings. Lost it. Slide's not important. Having launched last summer, we are a startup with just 10 months into our journey. But we are already working with over 100 hospitals, including Tufts, Lahey Health, South Coast, and Adventist Healthcare. We have helped these customers uncover $98 million in product waste opportunities through identifying a variation of product and practice. We're at booth 5 if you'd like to come visit us, but please partner with us to reduce the cost of best practices.
Thank you, Mark, for Viewpoint. Our next presenter is coming from Brass Valley, and this company addresses something that we all run into and always reminds me of that movie Office Space as a way to handle your old hardware. So please welcome Mr. Rocco D'Amico.
Thank you, everyone. Thank you, Jeff. Today I'm going to speak to you about a topic that you probably don't think about very often. It's what happens to your old IT equipment, your old medical equipment, when you're done using it. My company is Brass Valley. Excuse me. We started in business 13 years ago in Watertown, Connecticut, which is in an area called the Brass Valley, so now you know where we got our name from. We started out as IT resellers, and in the process of selling IT equipment, new equipment, we'd always get the question back, what should I do with my old equipment? So we looked at the electronics recycling market. And what we found was most of the electronics recyclers, certainly at that time, had evolved from the scrap metal industry. And I couldn't take those people in front of our clients because they just didn't understand the data security needs of our clients. So we decided to get into the business. Fast forward a little bit, and we developed a proficiency at search engine optimization. And people would type in Google searches for data destruction, computer recycling, hardware, hard drive destruction. We'd pop up first. So one day, the phone rang, and it just totally changed the trajectory of our company. It was the IT asset manager from VeriSign. And basically he said, and for those of you who don't know who VeriSign is, if you've ever done any kind of online banking or online shopping, VeriSign is the company that validates who you're talking to is really who you're talking to. So consequently, they're very paranoid about data security and data breaches because they're in the crosshairs of every bad guy out there, right? And also because of that, they're very much forward-thinking and early adopters in terms of adopting technology and processes to keep them ahead of the bad guys. So the gentleman said to us, hey, look, everybody in your industry is telling me they can erase my hard drives, they can shred my hard drives. They can't tell me that they can find all my hard drives. And they don't do anything to protect my data access points. He also said to me, if I'm audited, they don't have the type of documentation that I can be effective during an audit with. And one more thing, God forbid I ever have to go to court, their indemnification is insufficient too. So bridging that gap became the basis for what our company does today. So fast forward today, we started in my basement, and it's a small basement. We're in a 100,000 square foot facility now in Milford, Massachusetts. We work with some of the most security sensitive companies in the world, like Symantec, locally here, Citizens Bank. Folks that are concerned about brand protection, like ESPN. And at a high level, we provide asset recovery services, electronics recycling services, and data destruction services. Now, you guys might be all sitting there saying, hey, Rocco, that's great. That's a great story, but we've got somebody that we use already. So I'd like to have you consider just a couple of things. Number one, based on all the attorneys that I've spoken to, The minute your equipment leaves your building, liability is not severed. So if something goes wrong with that equipment or something bad happens, it's coming back to you. And a certificate of recycling or a bill of sale is not going to be enough to protect you. The other thing I'd like to have you understand is when it comes to, is the evolution or lack thereof in our industry. So in the beginning, there were the old electronic scrap guys that basically were scrap metal guys that raised their hand and said, I'm an e-cycler, I can take your equipment. Then another wave of companies came out that were asset recovery companies and say, hey, I'll give you a check and a bill of sale and I'll take your equipment. The problem with those companies and the thing they didn't get and the thing they still don't get is that with the advent of HIPAA, with the advent of C-level executives losing their jobs because of data breaches, what was once a disposal process has really morphed into a compliance and governance process. So how does that manifest itself with our company? Well, number one, we've got the first embedded media practice in the world. So that means it's more than the hard drive to us. We're going to look throughout all your equipment and find data access points, hidden hard drives, anything that's hidden, and we're going to erase that data and report on it in a way that's going to keep you in compliance. Number two, we have what we call an audit-ready chain of custody. So we mirrored what the hazmat people did, because the worst thing that can happen during asset disposal is an environmental event where you could be prosecuted as if it were a hazardous waste violation. So we mirrored the hazmat guys in the way they document it, so that way if something goes wrong, you've got the proper documentation in court to help support you. And last but not least, you won't be alone. We have a guarantee. We have a guarantee. It's a $10 million guarantee. It's a specialty policy from Lloyd's of London, custom made for us. So that way, if you have a HIPAA violation, we're going to pay for it. If you can't pass an audit, we're going to pay for it. If anything goes wrong, we're going to be with you. We're not going to leave you alone. So I have to bring this in for a landing now, because I've only got 5 minutes. But I'd love to tell you all we have free beer back at our table, but we don't. But what we do have is we have a free pilot program for anybody who's interested and would like to try our services, because I'm confident that once you try our services and compare us to what you're probably using now, you're going to be very pleased. Thank you very much, and enjoy the rest of the conference.
Thank you, Ralph. All right, so up next we have some fellows from RapidDoc, and they're going to attempt something that has yet to be done, and that's the tag team here. So we have Chirag Shah and Ashok Varavan.
Good afternoon all. I am Ashok Vairavan. I am a father of a 3-year-old boy. Last summer, my son fell sick. I tried to reach his pediatrician, but ended up in an answering service center. I explained the problem to the lady over there, and she convinced me that someone will call me back soon. I waited patiently for around 4 hours. After that, a physician called me back, asking me what the problem is. I do have a sick child, and I am explaining his health problem to different people again and again without getting any care. It's very frustrating, and it is a very big problem out there.
Hello, I'm Chirag Shah, and I'm the son of a physician. Growing up, I always noticed that my father had to leave the dinner table or any activity we were engaged in to attend to a phone call. What I overheard were the same questions, the same problems, and the same resolutions. So when he would come back to whatever we were doing, he would always look a bit more anxious and overall seem a bit more stressed. What I noticed was that over time, he always felt that he could never turn off. And so what do these two situations have in common? Frustration and miscommunication. So to circumvent many of these issues and alleviate many of these problems, we've developed RapidDoc. RapidDoc is a software as a service that hopes to streamline the after-hours care process for providers and patients. Based on our interviews with 30+ doctors and a survey conducted by PerfectServe, well, we've discovered that the root of all of these problems is the call operator. Particularly, 35% of all doctors have cited that these call operators exhibit high levels of human error, specifically related to the fact that they tend to contact the wrong on-call physician, provide incomplete, wrong, or entirely wrong information. And secondly, that they do not properly call screen. So they tend to send non-urgent issues, which would be appointments or prescription refills to the doctor after hours. And lastly, many of these call operating centers are not HIPAA compliant. So what does this lead to for the doctor? A lack of patient information, specifically related to a lack of patient background and the lack of full context about the actual issue. Secondly, due to the fact that many miscommunications may occur, there's a risk of malpractice. And as I mentioned earlier, there's a significant